I am always very surprised when I find out that most men with erectile dysfunction have never heard about the P-shot. It was such a big hype on social media a few years ago that I automatically assumed everybody knew about it. But I guess I'm wrong. The P-shot is a new treatment for permanently restoring penile erectile function using the patient's own blood. It is one of the emerging regenerative therapies in andrology and sexual medicine. In this video, I will explain how it works and the expected outcomes. My name is Stefan Buntrock and I'm a board-certified urologist and sexologist. The P-shot, or Priapus-shot, named after the ancient Greek god Priapus, involves the injection of the patient's own blood plasma into the penis. I think it is important to look at this kind of therapy from a totally different angle than you probably do. Forget about anything you think you know about pharmacological treatment with pills and injections. These principles don't apply here. Blood and its components should be regarded as tissue. You can even say it's an organ. This means that the P-shot is an act of transplantation. It represents the transplantation of your own tissue. Let's take an example so that you better understand what autologous tissue transplantation means. Say you have a severe burn injury. There's a big wound and the skin is gone. In these cases, you will need a skin transplantation. Skin will be taken from another place, like the thigh, and transplanted onto this wound. Injecting autologous blood plasma follows the same principle. Even though the P-shot uses your own blood, we are not talking about whole blood. What is injected into the penis is processed blood components. It all starts with drawing whole blood. The amount varies from clinic to clinic. I draw 60 milliliters. Then the blood is subjected to a centrifugation process to separate the different components. In principle, you end up with three components: red blood cells, plasma, and the buffy coat. You want the buffy coat and some plasma for the P-shot because it contains the other cellular components of blood, most of all platelets. Platelets contain lots of growth factors for tissue regeneration. When they release these growth factors after injection, it has a rejuvenating effect. The term most commonly used for the final product for injection is platelet-rich plasma, or PRP. From 60 milliliters of blood, I get 4 milliliters of PRP. The concentration of platelets is 8 to 10 times higher in this preparation. However, it is not all about platelets. Plasma is also important. Thinking of it as a fluid without significance would be too simplistic. As I said, think tissue transplantation. It is about how these growth factors and plasma components work together that does the trick. Not to mention white blood cells, which also play an important role. How many injections do you need? Usually it's 3 to 4 with a few weeks between them. Regeneration processes need time, so don't expect results within days. Expect results within months. Depending on how severe your problem is, results can vary quite a bit. If you have mild erectile dysfunction, you may hope for full recovery. If your problem is severe, so that even Viagra isn't effective anymore, well, there is a chance that it regains effectiveness after the P-shot. Age plays a role as well. The older you are, the longer it takes for your body to regenerate. The P-shot is not a miracle treatment. If you are 75 with many years of erectile dysfunction, and now you have met that hot 30-year-old woman on Tinder who wants to have sex with you twice a day, you need a miracle, my friend, not a P-shot. Anyway, there are lots of unanswered questions since it is still a very new form of treatment. And even if the YouTube community seems to have lost interest after the big hype 3 years ago, the medical societies haven't even started to endorse it in their guidelines. So, what is my conclusion? So far, I have seen the whole spectrum. Some patients have incredible effects while others don't. The problem is that the mind plays an important role in erections as well, and it potentially interferes with treatment outcomes. But overall, I am convinced that regenerative therapies are the future. Thanks for watching. Bye-bye.